Welcome to my world, the world of a medical laboratory scientist. Health is wealth, knowledge is power. Headache and brain cancer. That is the topic for now, and I hope we can gain so much from it. The headache is a very common phenomenon and is assumed to be a symptom. It's not usually the cause. So when there are muscles and pains in other regions, this message is now sent to the brain, and the brain recall as pain and headache where necessary, so that the body, the affected area can react and something urgent can be done. But the brain itself does not have any receptor, pain receptor. So that if there is any problem with the brain, how will the brain relay it to itself? That's where the headache of the brain is a very important factor when you are talking of brain cancer. The association of headache with brain cancer is something that helps in quick diagnosis. When the pain or the headache is very chronic and it's on for a very long time, when we say chronic, we mean it has lasted for over 3 months or more, then there is that suspicion if it is the brain. So there are certain tests that one can do: MRI, CT, CAT, and even up to checking the lumbar puncture and what have you, so that you can really get to know what is happening inside the brain. The brain has tumor, both benign and malignant tumor that we call cancer. So this study is meant to help us to understand more the kind of headache we have, a deeper knowledge of headache itself, and also how we can help in early detection of brain cancer. So if you like my presentation, always click the like button, subscribe, and more will be shown to you. The outline: objective, introduction, sign and symptoms, diagnosis, and finally treatment. The objective: to create more awareness of the various types of headache, the implication of chronic headache, and the various laboratory tests that could be done to rule out brain cancer, and where necessary, its treatment. There are 3 types of headache: the primary headache, secondary headache, and the neuropathies. The primary headache are not always caused by a medical problem. Once it's said to be primary, it means it is even the main cause. Like you are trying to say that it is not a symptom. Then the secondary headache are caused by a medical condition like visions or hearing problem, head injury, infection, cyanosis, brain tumor or disorder, or other side effects, even the side effect of treatment of cancers. The neuropathies are those that has to do with the nerves. Facial pain and headache that aren't in other categories may be caused by nerve damage or might be related to certain food or drinks. Acute and chronic headaches are also distinguishable. The acute, is just experienced for 1 or 2 days and it goes. But the chronic takes about 15 days. It comes the next month for almost 3 months. It continues and the pattern is the same. Now, headache disorders continues to be among the most prevalent and burdensome condition worldwide. When you talk of this prevalence, affecting 2.9 billion people worldwide, we can understand almost everybody has headache. That is nearly 1 in every 3 people, and ranking 6th among all causes of health loss in 2023. A new analysis from the Global Burden of Disease 2023 study published online on November 12 in Lancet Neurology exposes that. Down to brain tumor. Headache are the most common symptom of brain tumors. caused by the tumor pressing on healthy cells or increasing pressure within the skull. That will seriously bring out headache. They are usually accompanied by other neurological symptoms and exhibit specific characteristics. They are new or different from usual headaches that a person knows. They become progressively worse in frequency and intensity. They are often worse in morning or wake you up at night. They might not get better with over-the-counter pain medications. And these are more or less part of the signs and symptoms. The signs and symptoms. This diagram depicts it all. You can see visual disturbance such as by blood or double visions, weakness or paralysis. It affects even morning creating this nausea. The other common effect is the seizure that is experienced. It could show seizure, but after testing, it could be as a result of tumor. The personality changes is also other one. So frequent headache, dizziness, and hearing impairment. Right. The laboratory could be very useful, especially when we perform some tests just to know whether there is any abnormality or derangement that could pinpoint suspicion of a brain tumor. It's not truly a screening test, but the malignant ones that result in abnormal routine blood test results are what we check for. For example, inflammatory markers, elevated level of C-reactive protein, and also the erythrocyte sedimentation rate. We could also look for complete blood count, where we look for elevated neutrophil to lymphocyte ratio. There is also the molecular biomarkers, the liquid biopsies. Advanced liquid biopsy technique can detect specific molecular and genetic changes associated with brain tumor in the blood or CSF. Circulating tumor DNA is also another one. Then biopsy, which is the most definitive test for diagnosis and grading of it. Finally, treatment. We shall be using the case study online, Medscape online explanation on treatment. Shelby Espinosa had headache in the past. Doctors said they were related to back pain. But at age 22, she got a headache so severe that it caused her to stop mid-conversation. Now she says, I had to stop talking and just hold my head, she recalls. It was so intense that I couldn't think or respond. The pain would come and go, but the headache lingered for 3 days. Her back pain was gone, so she knew this was different. At the urging of her mom and then fiancé, Shelby went to the emergency room, where she had a CT scan of her brain. Results revealed a tumor the size of a kiwi pressing against her brainstem. She had surgery to remove it, and a biopsy confirmed it was a type of brain tumor called medulloblastoma. Headache that may indicate a brain tumor typically feel distinctly different from headaches you have had before, says Weathers. For example, people with chronic migraine are used to having headache, but their headache usually feels the same each time. So it shows to us, if we're now looking at treatment, the treatment for all cancers are either, first of all, the operation removing it so that you study whether it is benign or malignant. When it's malignant, it's cancerous, and so needing the chemotherapy or hormonal therapy or the radical surgery. Just radiation could also be used, and hopefully this may resolve the problem.
But radiation in the brain is another thing. However, this, if you like this presentation, watch more of my video channel on this video.